Hello everyone, our medical channel's lecture on medical knowledge is back again. Today, let's talk about the common cold. The common cold is a prevalent illness, usually caused by respiratory viruses. Symptoms of the common cold may include runny or blocked nose, cough, sore throat, sneezing, mild fever, body aches or fatigue, headaches, and so on. The common cold is typically spread through airborne droplets. For example, when someone sneezes or coughs, those around inhale these viruses. Additionally, touching surfaces contaminated with the virus and then touching one's mouth, nose, or eyes can also lead to infection. Regarding treatment for the common cold, generally, the following measures are taken. To alleviate symptoms, rest. Adequate rest aids in the body's recovery. Hydration. Maintaining adequate fluid intake helps balance hydration and assists in thinning mucus. Medication. Non-prescription medications such as antipyretics, cough suppressants, or decongestants can alleviate symptoms. Good hygiene practices. Regular hand washing, avoiding contact with infected individuals, and refraining from touching the eyes, nose, and mouth. Most common colds usually resolve on their own in about a week. If symptoms are severe or persist for a longer duration, it is advisable to seek professional advice. Especially for young children, the elderly, or those with weaker immune systems. Preventive measures include getting the flu vaccine, maintaining good personal hygiene, and avoiding contact with infected individuals. Children's colds share some similarities with those in adults but also have specific characteristics. Children, due to their underdeveloped immune systems, are more susceptible to viral infections. Especially those in group environments like schools or daycare centers, increasing the risk of contracting colds. Children often exhibit more prominent symptoms such as high fever, coughing, runny nose, and sore throat. They may also be more prone to feeling tired or uncomfortable. Young children, especially those under 5 years old, and individuals with weaker immune systems are more susceptible to colds and may experience more severe symptoms. Children are prone to spreading cold viruses in group settings like schools or daycare centers, due to their hygiene habits and underdeveloped immune systems, making it easy for them to transmit viruses to other children and family members. Cold in children may lead to complications such as ear infections, bronchitis, or pneumonia. Therefore, parents need to pay particular attention and seek medical advice promptly for children with colds. Treatment for children's colds typically involves relieving symptoms and providing supportive care. Ensuring children get adequate rest, stay hydrated, keep their noses clean, and providing appropriate medication to alleviate symptoms are common practices. Preventive measures include educating children about good hygiene practices, regular hand washing, avoiding contact with infected individuals, and getting vaccinated. In summary, although children's colds have specific characteristics, the general approach to managing them is similar to that of adults. It's essential to pay close attention to symptom development and seek professional help when necessary. There's a child named Hao Ming. He's a lively and curious 6-year-old boy. When he began to feel a slight sore throat, he didn't pay much attention to it. However, over the next few days, he started sneezing, had a runny nose, and the cough became frequent. His mother realized Hao Ming might have caught a cold. She took immediate steps to help alleviate his symptoms. She encouraged Hao Ming to drink plenty of water, get sufficient rest, and ensured he consumed nutritious food. Hao Ming's mother also taught him proper hygiene practices, such as frequent hand washing and covering his mouth and nose when sneezing or coughing, to prevent spreading the virus to other family members. She also encouraged him to avoid excessive contact with other children to prevent transmitting the cold virus. Hao Ming's cold didn't dampen his curiosity or exploration of the world. Though he felt a bit uncomfortable initially, he gradually regained his energy and spirit. To ensure Hao Ming had a pleasant time at home during his illness, his mother prepared some of his favorite books and toys. Despite his slightly diminished energy due to the cold, he utilized this time to read interesting stories and engage in less physically demanding games. Hao Ming's parents often accompanied him, telling interesting stories, singing songs, or doing simple craft activities together. This companionship not only made Hao Ming feel warm and secure but also strengthened the bond among family members. During the cold, Hao Ming's mother paid particular attention to his diet, providing him with nutritious and easily digestible foods like vegetables, fruits, soups, and warm beverages. These foods not only enhanced his immunity but also aided in his faster recovery. Though Hao Ming's symptoms made him feel a bit uncomfortable, with his mother's care and proper nursing, he gradually regained his health. Through adequate rest, proper diet, and family care, Hao Ming quickly overcame the cold and regained his vitality. During the cold, Hao Ming's mother also educated him on the importance of maintaining good hygiene practices. She instructed him to wash his hands frequently, especially after coughing, sneezing, or going outdoors. Hao Ming learned how to correctly use tissues or his elbow to cover his mouth and nose, reducing the chances of spreading the virus to others. Hao Ming also learned to avoid close contact with others during illness, particularly with friends or family members, understanding that it was essential to protect everyone's health. Throughout the illness, Hao Ming developed a greater appreciation for the importance of good health. He realized that taking care of one's physical health is crucial and learned simple methods to prevent colds, such as frequent hand washing, avoiding close contact with sick people, and maintaining good lifestyle habits. Ultimately, Hao Ming successfully conquered the cold. During this healing period, he learned a great deal. His emphasis on health and understanding of hygiene not only assisted in his own recovery, but also helped him better comprehend how to maintain his and others' health. This experience made Hao Ming more responsible and health conscious, laying a significant foundation for his future growth. This story teaches us that when dealing with childhood colds, several points are crucial: ensuring children consume adequate water, as adequate fluid intake helps maintain hydration, thins mucus, and aids in alleviating throat discomfort. Providing easily digestible foods such as soup, fruits, and vegetables is also essential. Children need sufficient rest to aid in their body's recovery, so ensuring they have adequate sleep and rest time is crucial. Using appropriate non-prescription medications under a doctor's guidance to alleviate symptoms such as fever reducers, cough suppressants, or decongestants. Teaching children good hygiene practices, including frequent hand washing, proper use of tissues or elbow covering when coughing or sneezing, to reduce the risk of virus transmission. Minimizing children's excessive contact with other family members, particularly when they have contagious symptoms. Seeking medical advice promptly if a child's symptoms are severe, persist for an extended period, or if there's a risk of complications. Moreover, preventive measures are vital. Maintaining good hygiene practices, regular hand washing, avoiding contact with infected individuals, and getting vaccinated can significantly reduce the risk of cold transmission. These are basic preventive knowledge and recovery advice about colds, especially in children. We hope everyone, including children, stays healthy and happy. If you enjoyed our video, please subscribe to our channel. Thank you.